In this video I'm showing you the implantation of the Soleko FIL-SSF IOL with this simple technique that was described by Petros Petrou. It consists of creating these scleral tunnels with the trocar leaving the microcannula in. The tunnels begin 3.5 millimeters from the limbus and they penetrate the sclera at 2 millimeters from the limbus, creating a 1.5 millimeter scleral tunnel in which the plaques of the IOL will be buried after the surgery. These tunnels with the microcannulas will help us to perform any vitrectomy procedure prior to the implantation of the IOL. So, as you can see, the infusion line and one of the sclerotomies with one microcannula are placed 180 degrees apart, and the lens will not be implanted exactly at the 3 and 9 axis, but a little bit oblique in order to place the trocars in a more common position. Now I'm removing the IOL from the eye in my usual way, cutting it in the vitreous cavity from the limbus and moving it without moving the lens into the anterior chamber in order to reduce the trauma to the cornea. Checking the posterior pore, and now I'm preparing the eye to implant the IOL. This IOL requires enough good mydriasis, so I'm using ice hooks, and now I'm folding the lens into the cartridge and the injector. You have to be very careful not to pinch not to capture the IOL with the injector, checking it well. And now what I'm doing is inject the IOL into the vitreous cavity and holding the plaque with the serrated forceps where I can. Usually it is impossible to grasp it in the middle, but you can grab it anywhere, and then you inject the IOL into the vitreous cavity. And after this, with the second instrument, which is usually an ILM forceps opened to grab it easier, I grab the inner optic and then do the shaking hands, grab the plaque in the middle of the teeth. Now I'm taking out the microcannula, which is 23G, sliding it into the shaft of the forceps, and now I'm taking out very gently and slowly the first scleral plaque out of the eye. It will be over the conjunctiva, as you can see now. Very gently, you have to be very gently, not to stretch the IOL too much and not to break it. And now I'm doing it the same from the other side. I'm grabbing the plaque wherever I can, and then with the shaking hands I grab it exactly in the middle of the teeth. It is quite important in order to avoid ruptures of the plaques. And now I'm sliding again the microcannula through into the shaft of the forceps and very gently taking out the second plaque out of the eye over the conjunctiva. You can help pushing a little bit the sclera so that you do not push, you do not pull too much. And once it is out of the eye, as you can see now, the lens is fixed, and what we are going to do now is to push the plaque into this 1.5 millimeter scleral tunnel just until it is covered by the sclera there. This way it will be buried into these scleral tunnels, and also it will avoid the leakage of these sclerotomies. As you can see, then I'm pushing a little bit more and again a little bit more. As you can see, this technique is super easy and simple and fast, implanting the Soleko FIL IOL. However, when you check the position of these plaques with OCT, many of them are in the suprachoroidal space, but they do not migrate. So it is a good technique, very simple, very fast, but still it might not be as safe as the normal technique.